Welcome to the first day of spring, and we're going to have nice weather in Atlanta today. I know that I've met several of you from the northern states, so welcome to the South, y'all. My name is Anttila, and I know a lot of you in here. I work with NHSN. Over the past 2 years, I have been working with the long-term care component, started out with the acute care side, and been CDC for about almost 6 years now, so I'm happy to be here with you guys today. Before I begin, I do want to ask you a question for your consideration. If you wanted to compare your surveillance data to another nursing home in your community that cared for a similar resident population, how confident are you that events will be tracked in the same way? How many of you are completely confident? Slightly confident? Highly doubtful? Not even sure how to compare surveillance data. Well, hopefully I can help you with some of that today. I'm going to provide you with an overview of NHSN. Some of this will be a small repetition of what Janita shared with you all, but I hope to take you into a little bit of a deeper dive. In this session, we will define the National Healthcare Safety Network, also referred to as NHSN, as well as the different components and modules available within the NHSN, including the long-term care facility. We will describe how NHSN supports our long-term care facilities, infection prevention activities, and we will discuss the steps of the checklist for participating in NHSN. How many of you were with us last year? And so for all of you who have been with us in the past 2 years, I would say you realize how significant this picture is, right? We started out with a team of 3, and over just this past year, we have grown tremendously. We now have additional infection prevention support on the team. We have additional medical epidemiologists. We have Janita to lead our team. And so we're super excited. We have an educator and additional analysis support. So we're so excited to have these new folks on our team, and we look forward to the opportunity to really be able to hit the ground running and helping you all meet success. I also want to mention our user support team. I know that you all deal a lot with just the front line. Our user support team deal with answering the technical questions and a lot of the application-related questions to NHSN, so they are the frontline defense for us. And Leah Bargan, which many of you already know, she does a lot with the group work, and then David Jordan, and then also Teresa Marrow, which many of you know and I know love. Teresa did not have a picture for me to include, so apologize for that. This is a busy slide, but I wanted to give you a scope of how big the NHSN is. As Janita alluded, the NHSN is a secure internet-based surveillance system and is managed by the Centers for Disease Control and Prevention, which is why you're here today, and is open to a variety of healthcare facilities, as you're going to be hearing about throughout this week if you're here and for your web streamers. And it's open to these facilities in the United States. And it allows these facilities to collect and analyze data related to healthcare-associated infections or HAIs, other adverse healthcare events, antimicrobial use and resistance, adherence to prevention practices and facilities, antibiotic stewardship programs, and much more. I want to point out in the middle that we have 5 components that are currently available for users. The biovigilance component is used by hospitals to report blood transfusion events, safety events, and then we have the dialysis component, which is used for outpatient dialysis facilities. And the healthcare worker personnel safety component is used by all healthcare facilities, including long-term care facilities, to track staff safety events such as influenza vaccination among the healthcare workers. And then, of course, we have the long-term care facility component, which is used by our long-term care facilities across the U.S., the patient safety component used by acute care facilities across the U.S., and we have 2 additional components that are planned, and that is the outpatient procedure component and the neonatal component, and those are a future release date. Long-term care facilities have two components in which they are able to enroll and report out of. We have the long-term care facility component and then the healthcare personnel safety component. So the long-term care facility component allows facilities, long-term care facilities, to track resident infections and also track adherence to hand hygiene and gown and glove use in the facility. The healthcare personnel safety component allows the surveillance of staff influenza vaccination. Today, I will focus on the long-term care facility component. If you are interested in the healthcare personnel safety, I have a link at the bottom of the slide where you can access additional information. But also want to let you know at the end of the day, we do have the pleasure of having a representative speak with you all about the healthcare personnel safety component if you're interested. Janita talked about the growth of NHSN already, but reporting in the long-term care facility component, I do want to emphasize, is specific for long-term care facilities. We use standardized surveillance definitions for long-term care facilities. Our definitions do differ from those definitions used by hospitals. I checked this week and was told that we have over 2,400 long-term care facilities currently enrolled in the NHSN since the launch of 2012. Just to give you a snapshot of the component itself, there are 3 modules within the long-term care facility component. There is the healthcare-associated infection module, and currently we have urinary tract infection reporting available out of this module, and we do look forward to growing this module to add additional healthcare-associated events under the module. But for now, urinary tract infections, and that does include catheter-associated as well as non-catheter-associated urinary tract infections. We have the Laboratory Identified Event Module, or the Lab ID, you will hear me refer to. And within that module, we have the multi-drug resistant organisms and Clostridium difficile infection. And this module uses laboratory data as a proxy measure for reporting events in the facility. And then lastly, we have the Prevention Process Measure module, which allows facilities to track hand hygiene and gown and glove use within the facility. For today's training, we will focus primarily on urinary tract infections and then events out of the Lab ID event module, the C. difficile and the multi-drug resistant organisms. Certified nursing facilities, or SNFs, and nursing homes are eligible to report in the long-term care facility component. Those facilities represent the largest majority of our currently enrolled facilities. Also, intermediate chronic care facilities for the developmentally disabled are able to report and fully use our component. And then assisted living facilities and residential care facilities are also able to use the long-term care facility component with limited access to prevention process measures. Here is the checklist I was speaking about. When I teach new users how to use NHSN, I like to use this checklist, and I have found that it is helpful for new users to have an idea of what all is involved with NHSN participation. So here it is. We will begin with the NHSN Annual Facility Survey, which I think most of you have probably recently completed. Before I begin with that, I do want to mention the NHSN forms and table of instructions that are available on our website. You will hear about these throughout the day as I talk about different modules that you may participate. So I want to highlight it quickly for you. Every form that requires you to collect data has, or every data entry that is required within that NHSN application has an associated form. And the form allows you to collect the data before you're ready to actually enter it into the NHSN. Every form also has a table of instructions with details of how to complete the form if you have specific questions. These forms are available on our website. I also want to mention that the forms are customizable. Most of them are. And what that means is that they are available on our website to you in a Word as well as a PDF format. And the Word format allows you to download the form and make edits to the form so that you can customize it to meet the needs of your facility. I do want you to keep in mind that even if you edit our forms, you must still follow the NHSN protocols exactly as outlined on those forms. So the forms are available, you can see here on our webpage. If you go down to the bottom, under each module, so these are the modules here, so this is the MDRO module. If you click in that box, it opens up another box for you. And within this box, if you go to data collection forms, you will see all of our forms as well as the table of instructions available for each form, okay? So next I want to talk about the annual facility survey. The annual facility survey must be completed every year after January 1st and before March 1st. Most of the survey questions are based on the characteristics and practices of your facility during the previous calendar year, which means you all for this calendar year completed a survey for the 2016 calendar year. We do recommend facilities to collect all of the required information using that available paper form I just talked about, because the electronic version, when you go to enter this information in the NHSN application, you must enter the form in its entirety before you are allowed to save the data. So that means that when you're ready to sit down at the computer, you need to have all of the data elements available to you. I think it goes without saying that accuracy is important. Responses on this annual survey may be used in the risk adjustment of data in the analysis. So let's talk a little bit about adding and editing the annual survey. To access the survey on the home screen of NHSN, you want to go to your left navigation bar. This is the navigation bar, and you will hear me speak to this a lot today. Go to Survey. If you want to add a survey, you click Add, and so that's what we're going to do first. Another option that you can use to access your survey, so you can either click Add, or how many of you have seen this on your home screen? This is another way to access, and we will talk about alerts throughout the day as well. But you can access your survey by clicking directly in that survey alert box as well. So there's two ways. Click your survey alert box or go to surveys and click add. Once you click add, you're going to have this screen. The facility ID will auto-populate for you. So all you need to do is select your survey year. There we go. So for this year, you selected 2016. Actually, I'm showing you a different screen here. So what I'm showing you now is how to find your survey. So we talked about adding, so now we're talking about finding. I apologize. So to find, you click from survey to find, and then 2016, and then find. If you are making edits to your survey, it is very important that you remember to save your edits. We do get some questions about this. We have users that will go in and make edits to the survey, and then the edits are no longer there. So to edit your survey, as I talked about, you're going to click the year you want to edit. So let's say we have additional information or a change in information for 2016. We find it, you scroll to the bottom, you click edit. And then remember to save when you're done. So the good news is you only have to do that once a year. The next item on my checklist that I want to talk about is adding resident care locations. So once a facility completes enrollment for the first time, the resident care locations must be set up, and we call this mapped. And this is a prerequisite for entering event data within the NHSN application. So before a user is allowed to enter any event data, and that includes a monthly reporting plan, the resident care locations must be mapped within the NHSN application. The good news with that is that once that initial setup is done, the only time that you would have to make edits to your locations is if something significantly changed. So, for example, if your resident mix changed in that location, or if the location closed. Okay, so I'm going to talk just a little bit about locations. most long-term care facilities have locations in their facility where they house their residents, right? Some of you refer to those as units, wards, floor. I've heard them as pods, neighborhoods, etc. So each of those locations has to be mapped. And this is important because it provides information about the types of residents that are being cared for in that location, and that is important for risk adjustment of data. Keep in mind that nursing homes or skilled nursing facilities that are located within an acute care facility may have a CMS certification number that is different from that acute care facility. In those cases, it is important that that long-term care facility get mapped as its own facility type and report out of the long-term care facility component. We get a lot of questions about these nursing homes that are located in the walls of an acute care facility. So the important takeaway from that is to look at that CMS certification number or CCN number to determine if it matches the acute care facility or if it's different. If it's different, then that's your indication that the unit has to be set up as a long-term care facility and reporting out of its own component. These are the CDC location codes and descriptions that are available to you. For the sake of time, I am not going to go through these tables. I'm sure you appreciate that. But just to let you know that these are available in our protocols and on our webpage. Okay, so over the next several slides, I'm going to demonstrate how to add resident care locations in the NHSN application. Again, on that left navigation bar, you're going to first click Facility and then Locations. Then you're going to see options at the bottom that are to find a location that may have already been mapped or set up in your facility, or add a location. So let's click Add to add a location. You must complete all of the data fields that are indicated by the red asterisk. So your code and your label are free text that allow you to describe this location within your facility. So in other words, how are these units identified, or how is this unit identified by the staff in your facility? So you can see the example, 1 South, and it's a general nursing unit. The next box asks you to select a CDC location description from the drop-down. So you will select the CDC location description that best describes that unit and the resident population. Again, the previous slides that we just passed, those are the list of CDC locations for long-term care facilities, and they're also available on the hyperlink within this slide. The default status is active, and of course, if you're adding a location, you want to keep the status as active, so skip that one, and then indicate the bed size for that unit. Once you've done that, click Add, and you will see the location populate at the bottom of the screen, and you want to repeat these steps to add each resident care location in your facility. So again, once the locations are set up, the only time a user would need to revisit locations is to update the location. So maybe you need to update the bed size, or if the unit closes, you need to deactivate that location. So let's say that you're a new IP in a long-term care facility, and you want to visit the locations that have been mapped for that facility. You want to make sure that all the locations are accurate and are set up. So to do this, you would want to find your location. So you go to your left navigation bar and click Facility, then click Locations, and then you skip all of the white boxes up here and you go directly to Find. And when you click Find, it will populate all of the locations that are currently mapped for your facility. So you'll be able to see the status is active, the location code that best describes the unit by your staff, as well as the label, the CDC description, the bed size, etc. So map locations cannot be deleted. I know the button says delete, but that's wrong. You can't really delete a location because there may be data associated with that location. So you want to be able to keep that historical data within the application, right? So what that delete really should say is deactivate. So if you need to deactivate a location, you simply just go to the column here under delete and pick the row that you need to deactivate, put a check mark, and click delete. And again, that will not delete the location, it only deactivates that location. So the next time you run this list of your locations, what you're going to see is you'll still see that location, but it will say deactive instead of active. Make sense? Okay. So before reporting data into NHSN, you must set up that NHSN monthly reporting plan. So you can see there's an order here. You can't set up the monthly reporting plan until you have your locations set up, and you can't set up your locations unless you have the annual facility survey on file. So I'm kind of going in order, but the next thing I want to talk about is the NHSN monthly reporting plan. The monthly reporting plan informs CDC, NHSN, which modules a facility will follow and submit data for a given month. Think of it as the facility's commitment to entering data into the NHSN application. As I said, a monthly reporting plan must be in place before events can be entered into the NHSN for that calendar month. A plan can be modified retrospectively. So for example, let's say that you're really getting ambitious or you got a new IP on board, and so you want to add an additional module to follow. You can retrospectively go back to that monthly reporting plan and add an additional module. Now, you can delete a module, but only if you have not entered data. If you have already entered event data in NHSN or summary denominator data, you cannot go back to the monthly reporting plan and delete that plan. Does that make sense? If you wanted to do that, then you would have to also go into the application and delete all of the associated event and denominator data, which probably don't want to do. You can enter a plan for up to 1 year in advance. So let's talk about the steps for entering a monthly reporting plan. On the home screen, that left navigation bar again, you want to click Reporting Plan and then Add. Next, select the month and year you intend to submit data to the NHSN, and then select your event option. So you can see that you have 3 options, or modules. I like to call these buckets, but technically they're modules. You have the HAI, or the Healthcare Associated Infection module, which I talked about earlier. And at this time, it allows users to report urinary tract infection events out of that module, and it does use the HAI methodology. The next bucket or module is the Lab ID event module, which gives facilities the option to report C. difficile and or common multi-drug resistant organisms that are available in the application. And this module uses the Lab ID event methodology, which you will learn about later today. And lastly, there's the option for the prevention process module, which allows facilities to report hand hygiene and gown and glove use data into the NHSN. So as I mentioned, users do have the option to edit these plans. So again, edit may be important if you want to add additional surveillance selections or remove a selection for the month. So to edit, you want to first find your reporting plan. So on the left navigation bar, click Reporting Plan and then Find. From there, you will need to select the month and year for the plan that you intend to edit. And then scroll down to the bottom of the screen and click the Edit button. And once you do this, you are able to make any changes to the plan. And then just remember to save your plan when you're done with your edits. Moving down the list. Once that monthly reporting plan is set up, facilities are ready to begin entering event and denominator data into the NHSN application. The steps for entering event level data will be discussed in the next sessions that I do today, so I'm going to skip that box for now, and I want to briefly talk about entering denominator data into NHSN. For every month in which a monthly reporting plan is set up, facilities must also report denominator data into the application. And this is important even if a facility did not identify events for the month. Okay, I'm going to say that again because we get a lot of questions. Even if your facility did not find or submit data for an event, you still must complete that denominator data, okay, if you have a monthly reporting plan on file. This is very important. Denominators are reported after the end of the month, and best practice is to enter these data within 30 days of the close of the month. So for the end of March, the best practice would be to enter the March denominator data by the end of April. NHSN does not have steadfast rules that say you have to enter by a specific time period, but if you go too long, then likely it's going to fall off your radar, or you may lose or forget some of the data that need to be entered. And I have a small screenshot here of how to access your denominator data. So again, on your NHSN homepage, you want to go to that left navigation bar, click Summary Data, and then Add. Once the Add Monthly Summary Data screen populates, select the month and year for which you will be entering your summary data, and you will notice something great that happens on this page. The summary data will pre-populate, as indicated by the red asterisk, with all of the required data based on your monthly reporting plan. Okay, so in the bottom screen here, I have your monthly reporting plan, just to show you, and here's your summary data. So you can see here for January 2017, our summary data populated with a red asterisk for every required data field. And if you look down here on our monthly reporting plan for January 2017, you'll notice that it matches, it correlates. So this is a good balance and check so that you don't have to keep up with remembering what's in that monthly reporting plan. Just enter the data with a red asterisk and you are good to go. Here's the forms again. I know I keep going back to these forms, but I think that they're very important, especially for our new users who are just coming on board and learning the system. There are 2 form options for collecting denominator data. Each option does include instructions for completing the form, which come in very handy. These forms are meant to provide you with the data fields for all of the required data that may be needed to enter into the NHSN application. One form is used to collect denominator data for the entire month, okay? And keeping in mind that only aggregate counts from these forms are entered into the NHSN application. We are moving right down our list. Next, I want to talk about resolving alerts in the NHSN application. Alerts are an easy way to begin conducting quality data checks in the NHSN application. Alerts are your friend, even though it doesn't feel like that, especially when you come in on a Monday morning and you have 1 billion alerts on your screen. It doesn't feel like it's your friend, but I promise you it's your friend because it assures you that once you resolve the alerts that you're going to have accurate and clean data in that NHSN application, which will be important when you're ready to pull the data out of an NHSN and show your administrators. The alerts are generated from the monthly reporting plan that you enter because that's how NHSN knows what you're following for the month, right? And they will focus on what you will see in long-term care. You will see mostly alerts based on incomplete or missing data. And Elizabeth is going to talk a lot more about alerts today, so I'm just giving you a little bit of a tease on these alerts. But as you can see, users have several options for identifying and resolving alerts. For example, you can click on the individual alert box, and that will open a line listing for your alerts. Or you can go to your navigation bar and click alerts. So let's pretend that we're going to click alerts from our navigation tab. When we do that, a line list will populate with hyperlinks to resolve each alert. So if you click on each hyperlink, it will take you to the page that needs a resolution. So again, Elizabeth is going to talk in more detail about alerts for you today during the analysis section. Okay, so we've completed the requirements for the checklist. The last item on the checklist that I do want to show you is how to add and deactivate NHSN users. This is important. The NHSN Facility Administrator has the option to add additional users to access NHSN data. And this includes assigning rights to that individual user. We recommend for each facility to have at least 2 additional users in that facility who are able to enter data, and perhaps at least 1 other user with NHSN administrative rights. And that way, if we know turnovers is a big deal in our long-term care facilities, so if your NHSN administrator leaves, it's great to have a backup plan, a backup person. Once a new user is added into the NHSN application, that user will receive an email from SAMS. I'm sure all of you know about SAMS by now, but we'll receive an email from SAMS with additional information of how to register with SAMS. We call that to get SAMS certified, SAMified. Okay, so let's talk about adding an additional user. So again, from that navigation bar, you want to go down to Users and click Add. Once you click Add, everything with a red asterisk will need to be completed. So the first box is the user ID. This can be up to 32 numbers and or letters. I don't recommend that you try to enter 32 numbers and or letters because you want this to be simple for that new user, right? One thing that I have found helpful is just to use their first initial and last name, and that makes it easy for the user. The next, but you have options. You can enter whatever you want. If you don't like the person, you could get really creative with the user ID. And that's good because you can't delete a user, so you could really have fun with these user IDs. Okay. I probably shouldn't have said that. So you would enter the first and last name. Be sure when you get to the email address, this is the most important field that you can enter because the user is stuck with this email address. They will use this email address through SAMS. They will use this email address to complete their enrollment process. So the email address, just verify the accuracy and also make sure that the user email address is unique to that user. We do not encourage the use of generic emails in the facility. It makes it very complicated for you and your users when events happen in your facility, such as staff turnover. So if you are able to give a unique email to the user, that would be fantastic. Once you add the user, you come to the next screen that enables you to assign and save rights to the user. So remember I was talking about at least having another user with that NHSN administrative rights. And to do that, you would simply just put a check mark here. So be sure you're under the right component, which is the long-term care. And this first box, administrator, gives the user all rights, the same rights that you as the NHSN administrator have. If you have a student or someone in the facility that you just want to be able to look at data, you can just give a right to view data. So it's up to you how you assign these rights. So once you assign the rights, you click Save, and by clicking Save, that will generate an email from SAMS to that user. Once you are done working in the NHSN application, we do want to encourage you to log out. I know I'm guilty of this, simply just closing the browser. When you do that, the browser remains open, meaning that your data is still susceptible to breach. It also potentially slows down the NHSN application for other users across the board. So if you could just remember to log out here, we give you 2 options to log out at the bottom of your navigation, or if you click up to your name and the arrow down button, it gives you another log out option. Okay, we're not done yet. The next thing I want to talk about, we're doing pretty good on time, are the long-term care facility component updates for 2017. We sent out an email to all of our users outlining the component changes, and they are listed on our website, but I want to review them quickly with you today. So our annual survey includes 3 additional questions on the survey, and these questions were better to align your facility with the 7 core elements of antibiotic stewardship for nursing homes that Janita touched on. We also, in addition to adding those 3 questions around antibiotic stewardship, we added additional analyses reports for you. And these, you have a line listing report to show how your facility is doing in meeting the elements. And then for our group users, there's a frequency table also available to look at how all of your facilities in the group are doing in terms of the antibiotic stewardship. We have a new document called NHSN Key Terms and Acronyms. Check that one out under supporting materials. I think you'll like that. Every year we make some edits to our organism list. This year is no exception, so we have additional organisms added, and then the taxonomy was also updated for some of the previously included organisms. We go to the Lab ID event module updates. We did add some clarification to the definition of C. difficile positive laboratory assay, and that is to specify that testing must occur on loose and unformed stools, loose/unformed stools. We also added some clarifications to the settings for Lab ID event reporting. And we included, in the past, or we've always had an inclusion in the protocol that said that specimens obtained while the resident is a patient in a long-term care facility are not included in long-term care facility data. But we did add an inclusion because we recognize that, and we've heard from our users, that sometimes residents will leave the long-term care facility and go to an emergency department and come right back the same day. Or they'll go to their own private physician and come right back. So we did add an inclusion to allow an exception for settings, meaning that if your resident leaves your facility and returns the day that he or she left or the next calendar day, you can include any specimens collected from an outpatient visit or an emergency department visit in with your Lab ID event counts. I see some eyes glossing over, and I will be talking about this a lot today so that you fully understand what this means for you. But I'm told by our users that this is a good thing, so I look forward to getting your feedback after we finish the Lab ID event component session today. We did also add an additional optional form and table of instructions to the Denominator summary data forms, and I've already shown that, so I won't spend a lot of time on that. And then we made some updates to our analysis reports for Clostridium difficile, and that's just to add some clarification, and Elizabeth will talk to you about that later today. For the UTI module, we made a change to the question, has a resident been discharged from an acute care facility in the previous 3 months? We did change that to previous 4 weeks, and that was to reduce some of the surveillance burden for our users. Again, we will talk about this in more detail during the UTI session today. And then we added an additional denominator variable to capture number of urine cultures ordered in your facility. And this allows facilities to really get an idea of what your ordering practices are and how they compare to your UTI rates and your antibiotic usage in your facility. Of course, here's our NHSN long-term care facility website where you can find all of the information that you ever wanted to know about reporting from long-term care facilities in the NHSN. It's time for a break, but we have some time, so if you have questions, I am happy to take your questions now. And I'm going to ask you to go to the mic if you have a question. We are web streaming, so the web streamers can only hear your question if you go to the mic. Uh-oh, maybe they're not on.
Hi, my name's Heather. I work with the Division of Public Health in North Carolina. I get a question a lot of times from my facilities about what to do if their administrator has left, how they can update their administrator in NHSN.
So we get this question a lot. It's a great question. Ideally, they would reassign the NHSN administrator role before the person leaves, but we learned that that does not happen. I won't even say rarely because it just doesn't. So what has to happen is the facility has to, on facility letterhead, send a letter to NHSN to reassign the NHSN facility administrator.
Thank you.
You can contact the NHSN box and they will give you some detailed instructions, but a letter does have to be sent from the long-term care facility administrator to reassign. Any more questions? Well, you guys are ready for a break. Okay, so we are going to return at 11 o'clock sharp, and we will talk about C. difficile infection surveillance and reporting. Thank you.